Are you ready to develop valuable skills you can put to work? Join the Virgin Islands Department of Labor's Work, Learn and Earn program. It is a 12 weeks paid work experience for out-of-school youth ages 17 to 24 with little to no work experience. This program provides you with the opportunity to develop your professional skills in a professional work environment in your area of interest, with the goal of connecting you to full-time employment. For more information, call us at 340-773-1994 on St. Croix or 340-776-3700 on St. Thomas, or email kevin.dixon@dol.vi.gov. The Youth and Apprenticeship Division is committed to building skills and making opportunities.
Good day. Welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of March 7th, 2022. For the benefit of the radio listening audience, I am Government House Communications Director Richard Mota. Joining me this afternoon is Health Commissioner Hussein Canacion for the latest COVID-19 data and information on where Virgin Islands residents can get a free COVID-19 test, vaccine, and booster shot this week. Commissioner Encarnacion.
Good afternoon, everyone, and thank you, Director Mota, for the opportunity to provide yet another COVID-19 update to the territory. As of this morning, March 7th, since the beginning of the pandemic, a total of 337,935 tests were conducted in the territory. 15,440 of those tests were positive, and thus far, 15,290 cases have recovered. Today, our 7-day positivity rate is 1.39%. I felt like I had to have a drum roll before that one. We want this number to remain below 3%. To do so, we will continue to provide the ancillary services needed, like contact tracing as a priority, so that we can continue to reduce and separate those that are positive, which it has actually been proven very effective and successful in reducing transference of the illness. Presently, we have provided 67,669 first doses of the vaccine and 56,001 second doses. And I say that with the numbers to say it's critical for us to ensure that we are continuing to provide vaccines and you are continuing to accept the vaccines, as that is the ultimate goal and the true source of reducing significantly throughout the nation, throughout the world, and throughout the territory. The territory is doing very well with a drastic reduction of community spread of COVID-19. We currently have 41 active cases in the territory, 26 active cases on St. Croix, 14 on St. Thomas, and 1 on St. John. As of this morning, there are 2 patients at Governor Wang F. Louis Hospital and Medical Center. One, of course, that one is on the ventilator, and there is 1 patient at the Schneider Regional Medical Center, and thank God that one is not ventilated. We have suffered a total of 109 fatalities since the onset of the pandemic. Fortunately, we have not suffered any additional deaths within the last 2 weeks. Our continued prayers and support go out to those who have lost loved ones. This is a great testimony to our efforts, to your efforts, and to our success. So thank you. We have had a bit of increased activity since the governor relaxed some of the COVID-19 protocols, and yet we continue to trend down towards 0 positives territory-wide. Again, it is because of what you have done to get us there. Thank you to everyone who is working with us, doing your part to reduce the transmission of this virus. This includes the number of you who have taken the COVID-19 vaccines and boosters. For those of you who haven't, here are some quick reminders. On St. Croix, vaccines for adults and children ages 5 to 17 are all available at the Nissan Center in La Grande Princess, adjacent to the Honda dealership and the paint shop on the same side of the street as Food Town. Can't miss it. The CVC is open Monday through Friday, 8 a.m. to 4 p.m. On St. Thomas, vaccines for ages 12 and older are available Monday through Friday, 8 a.m. to 4 p.m. at the CVC located at the Community Health Clinic on the second floor of SRMC. On St. Thomas, pediatric vaccines ages 6 to 7 are only available on Tuesdays and Fridays at the Maternal Child Health from 8 a.m. to 4 p.m. Please call for an appointment, and the number to call is 340-777-8227. Please bring an ID for the parent or guardian and the child, as well as the child's birth certificate. Remember, that is in St. Thomas. In St. Croix, everyone can go to our CVC. On St. John, vaccines are available for all ages, that's 6 years old and above, every Wednesday from 1 to 4 p.m. at the Port Authority gravel lot. Please note that this testing is also available at the Port Authority testing lot. That's the only place that you can go and get your vaccines as well as your testing. The testing is available from 12 noon to 3 p.m. You can register for the test by calling or by going online at www.covid19.usvi.care/testing. It helps to expedite the process and gets you out of there faster. Vaccines are still available to the homebound. When making your appointment for yourself, a frail or disabled relative or child, ask for homebound services and the Department of Health can bring the COVID-19 vaccines to you. Please remember you have the option to use online scheduling when making appointments for vaccines, whether the appointment is for you, your child, or someone else that you're caring for. Online, you can get an appointment at covid19usvi.com/vaccines or by calling 340-777-8227. That is the Vitima hotline. We have reduced our COVID-19 hotline hours to 8 a.m. to 5 p.m. Monday through Friday. That change is because of the decreased number of calls we've been receiving and activities that we have been able to approve or actually provide to you. The hotline number, as a reminder, is 340-712-6299 or 340-776-1519. Vaccine pop-up events for this week remain the same. In St. Croix, Tuesday, Wednesday, and Thursday from 10 a.m. to 1 p.m. at the market, formerly known as the Plaza Extra West. And at the Farmers Market at the Agriculture Fairgrounds on Center Line Road every Saturday from 7 a.m. to 11 a.m. St. Thomas, Tuesdays and Thursdays from 12 p.m. to 3 p.m. at Cost You Less, and the VI Youth, this is regarding the giveaway that we're doing, the incentive program. The VI Youth $250 gift card giveaway is still in progress. The program will end on Friday, March 18th, so please complete the process to get your children fully vaccinated within the next 2 weeks. Children ages 5 to 17 who receive their second dose of Pfizer between these days will receive a $250 gift card at the time of the second dose administration. And once again, we'd like to remind parents of children who became fully vaccinated last year between November 30th and January 30th, your child will still receive the $250 incentive card. Gift card distribution is taking place at the CVCs on St. Thomas and St. Croix and at the Morris de Castro building on St. John between the hours of 9 a.m. and 4 p.m. And why are we completing the initiative? And that is because surrounding the children, we really want to keep the school safe and to keep everyone in school. We're also doing some testing. So a combination of vaccine and testing, but first priority, vaccines. Some community-wide COVID-19 reminders. There is COVID-19 daily testing on St. Thomas and St. Croix by appointment for anyone that is sick or has been in contact with someone that has tested positive for COVID-19. To schedule an appointment online, visit www.covid19.usvi.care/testing or call our epidemiology hotlines, and I'll repeat them for you as well, 340-712-6299 or 340-776-1519. There is a pop-up testing on Wednesdays on St. John, as I said, 12 noon to 3 p.m. at the VI Port Authority gravel lot. And you can always go ahead and link into the website and register yourself. Lastly, there is once a month testing for the Department of Education, the last Friday of every month in St. Croix at Complex High School and St. Thomas at Old Cinema at 01 parking lot. The next VIDE pop-up testing is on Friday, March 25th from 3 p.m. to 5 p.m. And that is the one that I spoke about, is we are trying to test to make sure that children are able to stay to school. And we've been very successful in able to pull out the ones that have been positive and separate them from other students and teachers and faculty as well, so that we can make sure we keep everyone safe. As you know, COVID-19 is still circulating in little bits, but we're still here and we're still fighting. Last week, the governor announced that the Department of Health would no longer require permits for gathering and events with expected attendance under 1,000. Events larger than 999 people will be required to obtain Department of Health clearance. Also last week, Government of the Virgin Islands employees were asked to return in-person work schedules on Tuesday by March 1st. Additionally, the governor is permitting all seated patrons in indoor bars and restaurants to go without a facial covering. Further to this, persons visiting outdoor areas of eating or drinking establishments would no longer be required to wear a mask. As of March 5th, travelers to the United States Virgin Islands with valid vaccination cards are no longer subjected to the previously required testing mandates. Effective today, Monday, March 7th, masks are no longer required for open-air outdoor public spaces. However, travelers are reminded that masks will be continued to be required while present in indoor and outdoor areas adjacent to airports and marine terminals. I ask that you use your cautionary measures when you're in close proximity to others, even if you're outdoor, especially if you have symptoms or you see that someone else has symptoms. The governor has paved the way for all Virgin Island public school students to return to classroom as of Monday, March 14th. Masks will continue to be required when students are in outdoor areas and all school campuses. That again is to keep children at school. We're now having the 340 HIV Summit. It is the first HIV Summit, and I think it's apropos to discuss it, and this is also a communicable disease. This week, the Division of Communicable Diseases is hosting the first 340 HIV Summit on Thursday, March 10th and Friday, March 11th at the University of the Virgin Islands St. Croix campus. As I said, this is the first such summit to be held in the Virgin Islands and will bring together primary care providers, allied healthcare professionals, primary care healthcare teams, community organization, community health workers, and people who live with the experience from throughout the Caribbean. The Department of Health is very proud of the work that has been done to bring the summit together and to end HIV epidemic in the United States Virgin Islands by 2030. You can still register for the summit at https://bit.ly/HIV summit. If you have any questions, email robert.thompson@doh.vi.gov. robert.thompson@doh.vi.gov or pcdc@hip@pcdc.org. pcdc@hip@pecd.org. This will be a fully vaccinated event, and masks are required because it's indoor. Art contest. The winners of the Department of Health and CDC-sponsored Coming Through COVID-19 art contest have been determined and are as follows. St. John, first place goes to Walden Gil Perez. He's 17 years of age. Congratulations. St. Thomas, first place, Jamaica Smith, 17 years old. Second place, Shani Cheverall, age 15. Third place, Zanaisa Anthony, age 16. And fourth place, Arissa Breedy. In St. Croix, first place, Isabel Rodriguez. It's a tie, 15 years old. And Hope Samuel, also age 15. Second place, Mia Benton, and that's age 17. And I apologize, Mihaja or Mihaya. Please bear with me. Age 17, you are the second place winner. Third place, Tishia Alfred, age 16. And fourth place, Priya Mittal, age 15. Congratulations to all of you. The public is also invited to visit www.comingthroughcovidusvi.art so that you can actually see and appreciate the hard work that these youngsters have actually given to us. In closing, let me remind everyone that you can keep up with the latest information, including COVID-19 epidemiology and vaccine data, by visiting the U.S. Virgin Islands Department of Health Facebook page or our website, www.covid19usvi.com. And for COVID-19 information alerts, text COVID-19 USVI to 888-777. But before I turn it over to you, Director, I wanted to remind everyone that COVID-19 is indeed still circulating. Our healthcare providers, I think, have been hit the hardest. Workforce has been decreased, and so I really want to impress upon you to please be safe, as they are continuing to work very hard with lingering effects of COVID. Thank you for the time to share this information with the public. I'm happy to take any questions. Back to you, Director Mota.
Thank you, Commissioner. As the Commissioner just mentioned, last week, Governor Bryan announced a significant reduction in COVID-related restrictions. However, as he pointed out, we are nowhere near out of the woods, and as the Commissioner just mentioned, we still have a very real problem in certain sectors of our community with COVID-19. The Governor has sent to the legislature today a request for the extension of the state of emergency. The entire country remains under a national state of emergency that was recently extended by President Biden beyond March 1st, 2022. Here locally, we believe the end to the state of emergency is in sight. However, having the state of emergency in place allows us to keep our most effective tools in protecting our community against the spread of COVID. One, it allows us to keep in place and effectively enforce the existing nursing home and hospital visitation regulations. It also allows us to continue to access additional emergency medical personnel to assist our medical professionals here at home. It allows us to keep in place the travel portal, which has been effective in serving as an added layer of protection to guard against community spread. And as was mentioned a little earlier, and speaking of our travel portal, effective today, fully vaccinated travelers are no longer required to submit a negative COVID-19 test to the travel portal. They simply need to upload their proof of vaccine record, whether fully vaccinated here in the United States Virgin Islands or on the United States mainland. Having the state of emergency here in place locally also will keep our National Guardsmen and women, the personnel at our community vaccination centers, and the other emergency medical responders, and fund the overtime costs to keep them on the front line of the effort to protect both you and me. The Governor's request to the 34th Legislature is for a 30-day extension to the existing state of public health emergency here in the territory, and we trust that the members of the body, as they have agreed in the past, will agree that we need to remain cautious and vigilant as we get closer to what we hope is the end of this pandemic globally. This afternoon, Governor Bryan joins the Executive Director of the Waste Management Authority and the St. Croix Waste Haulers for a meeting to discuss house-to-house pickup, trash services, and the fiscal concerns impacting the Virgin Islands Waste Management Authority in an effort to help insulate both the waste haulers and the public from the trickle effects of global inflation. The governor has waived tipping fees for all public pickup until January of 2023 to spare the taxpayers any immediate or steep increases in additional fees. Also this week, the governor will host a town hall meeting this Friday, March 11th in Coral Bay, St. John from 6 to 8 p.m. at the Calabash Community Center to discuss planned initiatives for the Coral Bay community and to allow Coral Bay residents to address any concerns they may have with key members of the administration's cabinet. Please keep in mind that while every effort will be made to accommodate everyone in person, it is very likely that seating may be limited. To that end, we encourage participants to RSVP ahead of time with the St. John Administrator's Office by calling 776-6484. Again, that number is 776-6484, or email artarawilkins@go.vi.gov. Again, that's artarawilkins@go.vi.gov, or Claudine Scatliff@go.vi.gov. If you RSVP by email, be sure to put in the subject line of your email, Coral Bay Town Hall RSVP. The town hall will also air live here on our Facebook page and on the Government Access Channel, which is Channel 27, if you have VIA, for those who are not able to make it in person. And of course, we also invite our media partners in radio to also, if they're so inclined, carry that to their radio listening audience as well. Lastly, this afternoon, Governor Bryan is scheduled to meet with the Virgin Islands Horse Racing Commission members this weekend to discuss the latest developments for the future of horse racing in the territory. As you know, Governor Bryan recently submitted legislation to the 34th Legislature to address the recent settlement of the lawsuit between the government of the Virgin Islands, Southland Gaming, and VIGL that was blocking the redevelopment of the Clinton Phipps racetrack on St. Thomas. Under the agreement, Southland will construct a facility in the grandstand and provide 50 VLTs. VIGL will operate the VLT facility and promote the races at the track. Southland also agreed to commit up to $100,000 each race day for a maximum of up to $600,000 annually toward purses at the racetrack for the duration of its contract with the government of the Virgin Islands. VIGL is still responsible for the redevelopment of the Randall Doc James racetrack over here in St. Croix, as agreed to in its 2016 agreement with the government of the Virgin Islands. That concludes our press briefing this afternoon and our updates for you, the public, this afternoon. I will take any questions from the media if there are any. Suzanne Ellis from the Virgin Islands Source.
Thank you, Richard. Good afternoon.
Good afternoon.
I have a couple of questions for the Commissioner about the testing of children at Complex. Are you only testing children or teachers, and are they randomly selected? And is there testing going on at any of the other schools?
Hi, Susan, and thank you for your question. The testing actually, it takes place at those two areas. However, it's open to all. So it's not just specifically for the complex. That's just the location the testing is going to be. And in reference to how we choose those, we test anyone that is symptomatic. And of course, the goal is to test at least 5% of the population of education. That would include teachers, other members of the staff, as well as students. So we're doing a combination of all. And it's really and truly we select them, but the teachers and principal assist us in terms of selecting. So there's no specific reason or why we're selecting them. But of course, if anyone comes symptomatic, we pull those out and we test them. So that's really and truly the goal right now is to only test symptomatics.
Okay, great. And is there are there locations on the other islands as well, or just St. Croix?
No, we test in St. Croix, we test in St. Thomas as well for St. Thomas, St. John. I'm looking for give me 1 second, I'll go back. So it's in St. Croix and in St. Thomas. And of course in St. John, from 12 to 3 in the VI Port Authority Gravel Lot. And so we work with the Department of Education to make sure that everyone is aware. And so we announce these on a weekly basis. It's on our website. So St. Thomas, St. Croix, and St. John. Everyone's covered.
Oh, okay, but there's no other testing at the schools other than at Complex?
Not at the schools per se. Everyone goes to the complex on St. Croix to be tested.
Okay. Thank you.
Let me just clarify that, Suzanne. If by chance education, and we work very closely with education, we do it regularly, if by chance they feel as though there's one particular school that has a surge, a higher number of positives, then we go to that school for testing. But on sporadic testing, no, they go to the complex. Does that make sense? Hopefully it does.
It sure does.
Okay, good.
It sure does. Thank you.
Sounds good. You're welcome.
You had any additional questions, Suzanne?
That's it. Thank you.
Thank you very much. I think that is it for questions from the media this afternoon. Thank you. Please remember to wear your mask where required, follow the guidance from our Department of Health, and get the vaccine and booster shot now that both are available. Thank you for joining us this afternoon. See you next Monday.